Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care, so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered. And in last week's episode I answered another question from one of our readers, and the question last week was: my son's father had a heart attack and is not waking up in intensive care after cooling therapy. Please help. You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from one of our readers. And the question this week is: my husband is in intensive care with pancreatitis and liver failure. He's on a ventilator, in an induced coma, and he's bleeding. Help. This question from Lisa formed part of an email consulting and counselling strategy session with me. So, Lisa writes: Hi Patrick, my 57-year-old husband is in intensive care with pancreatitis and liver failure, due to him being a heavy drinker. He's on a ventilator in an induced coma, and he's got internal bleeding from his stomach, and he has been vomiting blood. They have been giving him numerous blood transfusions. The intensive care team has been very vague about his prognosis, and they're trying to avoid answering my questions. I'm very worried that he may die, and I'm extremely scared about the future. Can you please shed some light on this difficult situation and tell me what I should be doing? Thank you, Lisa. Here's my response. Hi Lisa, thank you for sending through your question, and thank you for signing up for email consulting and counseling with me. Firstly, the situation your husband is in is not an unusual situation when being admitted to intensive care for chronic alcohol abuse with liver failure and pancreatitis. I have seen it over and over again. Let me explain. Liver failure and pancreatitis often go hand in hand after chronic alcohol abuse. Whenever the liver is affected, the blood clotting mechanisms usually get out of order pretty quickly, and therefore critically ill patients in liver failure are at high risk of bleeding. Hence, the stomach bleeding is not a surprise by any means. It's often what happens. On top of that, your husband's natural stomach content and flora would have most likely been imbalanced prior to hospital admission due to the heavy drinking. Giving blood products is the right thing to do in order to get your husband through this critical stage and keeping him alive. On top of that, they will most likely have started him on inotropes, which is intravenous infusions to maintain a decent blood pressure. As with all the bleeding, he would have lost significant amounts of blood volume, and therefore his blood pressure would have dropped significantly to critically low levels. The intensive care team should have been able to wean down or even off some of the inotropes, as they were replacing the lost blood with blood transfusions. Furthermore, in order to also treat the stomach bleeding, they most likely would have started your husband on a pantoprazole or Somac infusion, or at the very least give your husband high doses of pantoprazole or Somac intravenously 2 or 3 times a day. Pantoprazole or Somac is a proton pump inhibitor that decreases the amount of acid produced in the stomach. The more acid in the stomach, the higher risk there is for a stomach bleed to occur, which is obviously highly risky. The next thing you need to investigate is why your husband has pancreatitis. there is a high chance that your husband's chronic alcohol abuse is directly causing the pancreatitis instead of the gallstones. Sometimes gallstones may cause pancreatitis. However, this is unlikely to be the case in your husband's situation. It doesn't surprise me that the intensive care team is vague and is trying to avoid answering your questions. Not only are many intensive care units and their teams poor communicators when it comes to talking to families in intensive care, furthermore they usually have their own agenda and simply they are rather busy. However, one issue that I've also found in more than 15 years intensive care nursing in 3 different countries, where I've literally worked with thousands of critically ill patients and their families, and where I have also worked as a nurse unit manager for more than 5 years, is that families in intensive care just simply don't know what questions they should be asking, and they don't know where to start. They also don't know how to position themselves and their critically ill loved one in order to get the best possible outcome for their loved one. In essence, they simply don't know how to negotiate and bargain for the best possible care and treatment for their critically ill loved one. And that's what I do. I help you to get the best possible outcome for your critically ill loved one and for your family, no matter the situation. A lot of families in intensive care simply put blind faith into the intensive care team without realizing that there are so many things happening behind the scenes in intensive care that directly affect how the intensive care team is communicating with you, with your family, and with your critically ill loved one. A quick example: if the intensive care unit is experiencing a very busy period with huge demand on their scarce, precious, and expensive intensive care beds, the intensive care team may decide to suggest to you and your family that a withdrawal of treatment, a limitation of treatment, or that a DNR, do not resuscitate, or an NFR, not for resuscitation order, might be quote-unquote in the best interest for your critically ill loved one. If that's the case, you and your family need to decide whether you are prepared to negotiate along those lines or not. You have choice the minute you have decided that you are the one in charge of your own destiny. The fact of the matter is that you need to be in a position to make informed decisions, get peace of mind, control, power, and influence quickly, because otherwise you, your family, and your husband might be in a position where the intensive care team is making decisions for you that you are not comfortable with. You need to very quickly educate yourself, get a crash course on what's really happening in intensive care, and put yourself in a strong position to get the outcomes for yourself and for your husband that you want and deserve. You need to be in charge of your own destiny and nobody else. Given that your husband is in an induced coma and on a ventilator, he might face an uphill battle of being weaned off the ventilator. The reason being is that my experience with liver failure and pancreatitis, induced coma and ventilation is that critically ill patients in that situation are even more fragile and vulnerable compared to other critically ill patients. Generally speaking, critically ill patients with liver failure and pancreatitis tend to be malnourished and have very few reserves to draw upon. Therefore, it is often difficult to wean them off the ventilator and get them out of the induced coma. Because of their primary liver and pancreas issues, some of the medications for the induced coma are not being metabolized properly, and therefore waking up after an induced coma can be delayed. Because critically ill patients with liver failure and pancreatitis often have bleeding issues, their general condition is not the best to deal with a critical illness. Having said that, time and patience is often the essence in intensive care, and being patient helps to master this challenge. you need to also start asking the right questions, assert yourself, and make sure you make informed decisions. Get peace of mind, control, power, and influence. Wishing you and your family all the very best. So, how can you become the best advocate for your critically ill loved one, and how can you get peace of mind, control, power, and influence quickly, make informed decisions whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power, and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to get peace of mind, real power, and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our blog section where I have more tips and strategies for you, and where I answer more of your questions, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me. Find our international phone numbers on our contacts tab. Also check out our product section where you get more ebooks, videos, and audio recordings, and where you can also get one-on-one counselling and consulting with me via Skype, over the phone, or via email by clicking on the products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.